Patrick, thank you very much, and thank you all for being here. I am so thrilled to be here with everyone, especially my colleague, Congressman Kennedy. Let's hear it again for Patrick. Good job, Patrick. Let me just say that Congressman Kennedy and I have been in lockstep every step of the way in fighting for health care reform, fighting for Rhode Island, fighting for America, making sure that the uninsured are covered, and that health care is affordable for everyone. I want to thank all of the people here at the table. Let me just thank again Patrick Quinn and Jane Hayward. I want to thank Alex for sharing your story with us. I see Nancy from Warwick, other patient advocates who are here who have been so important in creating this groundswell of support and moving this issue forward. Diane Sidlecki from the Rhode Island Medical Society, and Maureen Martin from AFL-CIO, and Emily Ayers for Organizing for America, and each and every one of you who have been so vitally important in making sure that the momentum didn't stop, but instead continued to grow, that helped us to get to Saturday night and actually see that bill passed. It was history making for the country, and you were all a part of it. By passing the bill on Saturday night, not only was it historic, but it was one step closer in solving our nation's healthcare crisis. It was one major step forward in changing the dynamic of healthcare in America from being one of where it's a privilege for the few that can afford it to being now a right for everyone. Everyone deserves good quality, affordable healthcare. It's a major step forward in covering the nearly 47 million Americans without health insurance, the over 100,000 Rhode Islanders without health insurance. It's a major step forward in eliminating pre-existing conditions as a reason for denying people being able to afford health care coverage. It's a major step forward of removing one of the major reasons why people go into bankruptcy. It's because of their high health care costs, a tragic accident, or a medical illness that they come down with that would force them, either if they didn't have health insurance, quickly into bankruptcy, or if you even had health insurance, that you quickly could exceed your yearly or lifetime caps. No one in America should be forced into bankruptcy because they get sick or because they have an accident that results in high medical bills. We're going to take that issue off the table. Never again is that going to happen in America. One of my favorite parts of the bill, and maybe one of the one that has gotten not as much attention as it should, is this thing called the medical loss ratio. That's the thing that's really going to change the dynamic of how we fund health care in America. You know, right now we've already heard about the high salaries of healthcare CEO executives. One particular health insurance company, the National Health Insurer, the CEO made over $100 million last year. I'll tell you, I've met a lot of bright people yet in my lifetime. I've yet to meet one that I believe is worth $100 million a year, let alone one whose salary comes out of health care premiums that we're all paying for. Well, the medical loss ratio now is going to change that. It's 85-15. What does that mean? It means 85% of health care premiums now have to go into paying for health care, and only 15% can come out for salaries or administrative costs. That's the thing that's changing the dynamic of healthcare in America, being a privilege for the few, but being a right for everyone. I believe everyone deserves good quality, affordable healthcare, and one step closer, but we're not there yet. Saturday night's passage of that major historic piece of legislation to fix our nation's healthcare crisis and establish universal healthcare is just one of the major hurdles. We've got to get it through the Senate, then it has to come back to the House and the Senate to pass in identical form. Then we have to get it to the president's desk. And I know, being with President Obama on Saturday morning, Patrick and I were with him as he came and he rallied the caucus on Saturday morning, and I know he's ready to sign that bill. But we need all of you there to continue the momentum to get us across the finish line. It was a major step on Saturday night. I know the bill isn't perfect, but it's a lot better than what we have right now, and it's going to get one step closer to really fixing our nation's healthcare system. Our patients, our children, our families, our workers, our companies are all depending on each and every one of you to continue the momentum, the enthusiasm. Let's not stop here. Let's keep it going. Let's get it across the finish line. It's the right thing for Rhode Island. It's the right thing for the country. Thank you so much for your great work. Keep up the great work. Thank you so much.
He's definitely not the least. I really want to thank him for moving the ball down the court very, very early on by putting forward his bill to bring everybody into the federal plan. It was a good discussion point. It moved us forward. It moved the discussion away from how do we get everybody covered to when are we going to get everybody covered. So I thank you for doing that, Congressman Langevin.